Neurologic conditions are probably among my favorite conditions that we treat. The mechanisms start with just increasing oxygen flow to the brain. And we see this a huge increase that, the brain is especially vulnerable to oxygen deprivation, and hyperbaric increases the cerebral blood flow, but more than that, it reduces cerebral edema up to 50%.
Mm.
And in one treatment. It's
Wow.
so fantastic that we've seen this, and that's research based. Obviously it's on rats causing an injury, but that huge change led us to look at anything that's an inflammatory neurologic condition.
Welcome to The Functional Edge. I'm Dr. Julia Ward, and this is where science meets real-world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. All right. Well, on today's episode of The Functional Edge, I'm joined by Dr. Alexander Lightstone Borsand, a dedicated physician whose journey bridges both allopathic and naturopathic medicine. After completing his medical education at Aureus University School of Medicine and further expanding his his expertise at Southwest College of Naturopathic Medicine, Dr. Borsand became a diplomat of the American College of Lifestyle Medicine, focusing on lifestyle interventions that prevent and reverse metabolic disease. His passion for hyperbaric oxygen therapy, or HBOT, as we'll now refer to it, was fueled by his own remarkable healing journey. Following a major injury, 5 surgeries, and a non-healing fracture, 60 hyperbaric dives transformed his recovery. Now, as the head of business development and community outreach at RxO2 and a certified trainer for the International Board of Undersea Medicine, Dr. Borsand works tirelessly to promote safe and effective hyperbaric treatments. We'll be diving into his personal experiences, the science behind HBOT, and how this innovative therapy aligns with the principles of functional and lifestyle medicine. So thank you again for joining us.
Yes, thank you so much for that introduction. I think I need to update that. Now it's been 7 surgeries on that arm.
Oh, wow.
Yeah, so it's interesting how our path brings us to where we're at in medicine. I'm sure, as yourself, you didn't get started on the functional medicine track. It didn't exist when we got started.
Right. Yeah.
But I think we found that what we do in our own lives and what we recommend for our patients developed that field. So
Yeah.
it's great to see that. So the American Board of Lifestyle Medicine is very much surrounded by functional medicine and really teaching our patients how to take accountability and take the steps to heal themselves. And it's the things that we already knew and we're doing, but we also find that as physicians that sometimes it's easier to give our patients what they want as opposed to what they need.
Yeah. Yeah. That's great. Okay. Well, I'm just going to actually open my door so my dog could get in because
Oh, I
I
love
hear
it.
scratching on the door.
Yes, no, I wish I had my dog in clinic today.
Goodbye, Teddy. I don't know if you want to see Teddy.
Yes, of course we do. I'm sure everybody does. Oh my gosh. I love it.
That is Teddy. He's a multi-poo.
And has Teddy been in the chamber yet?
Teddy goes in the chamber with me almost every day.
I am right there with you. In our home chamber, our dogs, as soon as I open the door, they're getting ready to get in. Anything we can do to extend their lifespan.
Their life? Yeah.
And the effects that we see for them, they're so real because the placebo effect, it only affects humans. Dogs, I mean, both my dogs, they're boxers. They have hip dysplasia. And when treating regularly, it's fantastic, the results.
Yeah. Yeah. I can't even begin to tell you. I mean, I was unfortunately in a little fender bender and Teddy got hurt when we were in this little car wreck. And he actually dislocated his shoulder. And since then, I can't even know, it's been over a year. It's been maybe close on 2 years, but he's been going regularly in the chamber with me. And I don't put supplemental oxygen on him because, I don't want to deal with putting a mask on a dog or putting him in a box,
It's not easy. I have the masks for our dogs. They
Yeah.
don't tolerate it well.
Yeah. Yeah.
It's like putting a muzzle on the dog. They
Yeah.
don't want it. And the reality is we'll get into this talking about hyperbaric air versus supplemental oxygen because there's a lot of new research on this. And
Yeah.
it's hard to know exactly where to to land on this newest research, there's benefits at all levels, and we're starting to see that. And I think, Jason Saunders' brand new research coming out right now kind of dives a little bit into that. And he talks about all different pressures. And, we may have a little bit of a different bias. And I think we all come in to everything that we do with a bias. It's hard not to. And as allopathic physicians, we prescribe oxygen. And as a chiropractor, he may not prescribe oxygen, and it may affect his bias a little bit differently. However, his patients get results. Our patients get results. And we have to take a step back and say, well, what are we both doing the same? And it's the pressure.
Yeah. Yeah. And so even without the extra oxygen, Teddy has gotten, immensely better, and that's just with the pressure and just breathing room air. So it's been great. Yeah.
Well, let's dive into hyperbarics.
Okay. So can you give us an overview of what hyperbaric oxygen, or HBOT, is and how it works on a physiological level?
Yeah. So this is like the elevator talk on hyperbaric, and it's so hard not to want to dive into all the aspects of it, but it comes from understanding first of how oxygen is carried in our body. And most people realize that oxygen is bound to your red blood cells or your hemoglobin. They may not realize that it's carrying about as much as it can at all times. Just about every patient has put on a pulse oximeter on their finger, and they've seen, 97, 98. But what does that really mean? Well, 98% of your red blood cells are carrying as much oxygen as they can, and that's just 4 molecules. They're never going to carry a 5th molecule no matter what you do. You can do what Lance Armstrong did and get more red blood cells, and there's other ways to try to get more oxygen in, but you're never going to carry more than what your red blood cells can carry. And further than that is, not all of that oxygen is actually available. Your hemoglobin's greedy, and it's going to give up 1 molecule, and maybe that 2nd molecule, but those 3rd and 4th molecules, they're not coming off until we're talking about that runner's high, or the point of, of almost dying. You just don't get them. So you really only have 50% of that available. So why is that so important as we start talking about hyperbaric? Well, hyperbaric, more pressure, simply means using pressure to force the oxygen into the liquid component of our body. And everybody's heard that our body's 60 or 70% water, and that water is really plasma. So we're turning your body into soda. We're taking a liquid and we're forcing a gas into it until it becomes soluble, until it dissolves. So now we carry more oxygen, but it's not bound to anything. It's freely available. At 3 atmospheres, the highest pressure we can treat at, we're increasing our plasma concentration 1,200%, and it's all freely available. So that's the crux of how hyperbaric works, but what does that really mean? So yes, we have more oxygen available. Well, our body uses oxygen to make cellular energy. And this isn't the Eastern idea of energy in our body. This is Western medicine. It is creating your mitochondria's ability to make more. Everybody knows the mitochondria is what? The powerhouse of the cell. That power is ATP. We make more of it with hyperbaric. That means more ability to heal, more ability to recruit cells. And historically, we've always thought that all the benefits of hyperbaric were inside the chamber. And new research has shown that's really untrue. There's benefits in the chamber. There's benefits for giving tissue what it needs. But when you get out of the chamber, there's a whole other cascade of effects that leads to other growth factor releases, other stem cell release, and maybe 50% of the benefits in the chamber, maybe 50% out. We don't know. Maybe it's 20% of the benefits in the chamber, 80% is getting out. The newest studies on that are only just a couple of years old, and we're talking about the hypoxic paradox by Dr. Efrati out of Israel. His research on post-COVID, on DNA protection with hyperbaric, it's all fantastic. So that's the long elevator speech, and it doesn't even scratch the surface.
Yeah, that's awesome. What are some of the most common conditions for which HBOT is currently used, both in conventional and functional medicine?
That's another one of these questions where it's so in conventional medicine, the 15 on-label indications, and that just until last year it was 14 on-label, and just a few years before that was 11 on-label indications. I was just at the most recent meeting where we're talking about voting on some brand new indications, hopefully irritable bowel syndromes, possibly looking into traumatic brain injuries again, although I know that there's been a lot of pushback on that. We'll get into that. But so the most commonly treated probably are wounds. However,
Yeah.
hospitals are terrible at this, and it has to do with inclusion criteria. And what I mean by this is just because you have a diabetic non-healing wound doesn't mean that insurance is going to cover it, doesn't mean the hospital can treat you, or the time that they take to get you qualified to get in. So covering hyperbaric in the hospital means that we're looking at a lot of wounds, maybe gangrene. Now we're talking about something called avascular necrosis of the femoral head, not enough blood flow to the hip where the bone starts to die. And I'm like, great, we're looking at other indications, but what about avascular necrosis, the scaphoid? You've probably seen this scar on so many people because if you fall on the outstretched hand, you have to worry about that bone not having its blood supply and dying. That's not an approved indication. But we see that if it works for the hip, it's going to work for the hand. So what do we see? We see a lot of off-label indications. I have to say that more commonly now in our facilities, we're seeing a lot of neurologic conditions, but we see a lot of post-COVID. And why do we see all this post-COVID and long COVID? It's because traditional medicine has had a really hard time with treating this. They're treating each individual symptom, and they might be giving people stimulants for the fatigue, sodium for the POTS, all these different drugs, and the patient's not better. And you remember, traditional medicine doesn't really look at brain fog as a diagnosis. It's a hard diagnosis. We can't quantify it.
Yeah.
But hyperbaric is the only treatment I've found that really looks at all of those symptoms and is significant for them. So what walks into our door every day? Huge rise in post-COVID. Of course, we have a lot of patients treating for cognitive function, whether it's somebody that's already declining or protecting their cognitive function. I'm here in Scottsdale, Arizona, and we have a huge wellness movement. We have patients that are coming in to treat just for general wellness, athletic injuries, sports injuries. So it's hard to talk about hyperbaric without starting to sound a little bit like snake oil sometimes, because like, what can't we treat? Put it this way. If your disease process has an inflammatory component, more than likely hyperbaric will play a role in it. It's not a cure for disease. It's a foundation to give your body the ability to heal. It's one piece of the puzzle, but it's a good piece of that puzzle.
Yeah. And just to back up a little bit, when you talk about approved indications, you're talking about these 15 indications that insurance may or may not pay for. So beyond these 15, they're not going to pay or consider paying for it. But for these 15 conditions, you might get insurance to pay for the hyperbaric treatments.
Yeah. So that term approved or on-label indication, it's kind of a misnomer. And it's kind of like when we look at drugs in general in medicine. I mean, there's a couple drugs that have almost never been used on label.
Yeah.
I mean, we could talk about things like Viagra. Viagra is used to treat pulmonary hypertension, an extremely concerning disease, and it's an effective process there. It is not FDA approved to treat what it's used for more often than not. Botox is not FDA approved to treat all these fine lines and wrinkles. It's approved to treat migraines and other diseases. So using something off-label in medicine is historically where we determine that, great, we found a medication that's not going to cause an issue for patients, but we found that by using it regularly, we found other indications that it may be more effective for.
Right. Absolutely. Okay. So what makes HBOT such a powerful tool for healing, and why do you think it isn't more widely utilized in mainstream medicine?
So it's a powerful healing tool because if we look at its mechanisms, there are so many mechanisms we're just starting to understand. So hyperbaric's been around a long time. In the United States, look at back 1963, JFK's treating his infant son in a hyperbaric chamber. Go back to the 1920s, 1930s, there were hyperbaric facilities. 1950s hyperbaric surgery centers where they were doing surgery in them. So it's not that it hasn't been around a long time, but most of the mechanisms that we now understand from hyperbaric all come from research in 2019. That was just yesterday.
Yeah.
And so that was the discovery of HIF-1 alpha, hypoxia-inducing factor. And that was the Nobel Prize in Medicine in 2019. And so
Oh,
with that amazing research, we've now realized that we affect over 8,000 genes with hyperbaric oxygen therapy, turning on or turning off over 8,000 genes. So how is it such a powerful tool for healing? Well, we have anti-inflammatory properties. We target certain cytokines that are potently anti-inflammatory. It's analgesic. It decreases pain. The same mechanism that's targeted by ibuprofen. Hyperbaric oxygen therapy is a COX-2 inhibitor. It's the same target as ibuprofen. If a patient comes into me in pain and I ask them, well, do you normally take ibuprofen? They say, oh yeah, it's the only thing that really helps. And I say, great, hyperbaric's going to take away your pain as well. So as far as on the anti-inflammatory side, we upregulate some of the other side of the inflammatory side. So there's pro-inflammatory and anti-inflammatory. We increase, cytokines like IL-10, which is a huge part of autoimmune disease, and we can get deep into that. We can talk about the DNA protective aspects, that telomere aspect, getting cells back into their cell cycle for cellular senescence, stem cell mobilization, growth factors. We can talk about platelet-derived growth factors, which is this brand new aspect that we're really focusing on. And so many people are big believers in using platelet-rich plasma injections, and it's so amazing the results that have happened, whether it was for my wrist when I was in pain, or maybe my scalp to try to retain some hair. There's so many different ways it can be done. Well, we can increase platelet-derived growth factors just with a hyperbaric. So now if I have a patient that's telling me I'm going to go get PRP, I say, great, do 20 treatments with hyperbaric first. So when they do that blood draw, you can have the most growth factors. So that's a little bit, but why hasn't it become more mainstream? That is really hard. It probably comes from education aspect. And I mean, Dr. Ward, I don't know about your education, but for mine, I was taught nothing about hyperbaric. My
correct.
first approach to hyperbaric was as a patient. It was not something that was taught to us in medical school or in our internship or otherwise. It wasn't until you get to wound care or subspecialties. And even then, it's not always. And then the reality is that what is taught is that it's expensive and it's risky.
Yeah.
But the reality is that it's not expensive in terms of most hyperbaric treatments most medical treatments or even prescriptions. And then the other side of that is, everything in medicine has risks, but hyperbaric incident rates are so extremely low. And look at this from a really easy way to quantify this is if you as a provider add hyperbaric to your malpractice insurance, it is a tiny increase. Now try to add IV therapy to your malpractice. It's a huge increase. They're looking at what the incident rates are. They're saying IV is much more of a risk than hyperbaric is. But people don't look at IV. You wouldn't have somebody say, no, don't go get an IV. The risk is too high.
Yeah.
So,
Yeah.
So when I reach out to other providers, and ask them about it, they're like, well, no, it's for wound care. You just
don't know because it's not out there. And
they just
I think that's part of hyperbaric's problem is it just sounds too good to be true. Like it's fixing all these things and people are like, well, if it's all that, why haven't I heard about it before? Why hasn't my doctor recommended it before?
Yeah.
And then you have to go into the whole, well, it's just not embedded in our educational system.
It's not, and they don't realize it until it's a personal experience. Almost everybody in my field comes to it, and our field, comes to it from a personal experience, personal injury, or a family member. I don't know how many of these orthopedic surgeons that weren't referring people to us until it's a family member. And they want to do anything they can for a family member. And once they see that change, all of a sudden I'm seeing their patients regularly.
Yeah.
And we work with orthopedic surgeons. We're a referral-based clinic. And so we see a huge number of surgery patients.
Yeah. Yeah. That's great. So are there different types of hyperbaric chambers? And if so, how do they compare in terms of effectiveness and use cases?
So there are a number of different ones. And we can go and look at the regulatory aspects. So there's Class A chambers. These are meant for more than one person, multi-place chambers. There's Class B chambers, which are called monoplace chambers meant for one person. Class C chambers meant for veterinary, obviously the best chambers. And then there's mild hyperbaric, so it would be termed an altitude bag. Now, that's the wide of it, but now when we narrow that down, monoplace chambers, you might see some that are filled with 100% oxygen, some that aren't. Oxygen compressed chambers, I think, are very quickly on the way out. We don't see this as much. The chambers that we both use in our clinics are not compressed with oxygen, and this is the future. It's an efficiency aspect, but it's a patient safety aspect.
Mm-hmm.
And, we have all seen this tragedy that happened very recently in hyperbaric medicine. And it was in a chamber that was compressed with 100% oxygen. And there's been a number of these chambers throughout the years, and most of them don't have incidents. It's not that this is inherently dangerous, but it's more dangerous. And everything we can do to reduce that risk to our patients. So if we're talking about different types of chambers, you don't have more effective treatment by compressing the chamber with oxygen. You only absorb oxygen through your respiratory system and a little bit through your eyes, but not through your skin. So why would you compress the chamber?
Right.
Well, you don't have to wear a mask in those chambers, but that actually increases some risk as well, because if I need to turn off the oxygen for any reason, that chamber has somebody having to put on a mask to breathe air, where our chambers, you literally just turn off the oxygen and it's off. And that gets us into our talk about oxygen toxicity. So as we get into mild hyperbaric chambers, new research is coming out on these chambers. I have patients I treat at low pressure, especially pediatrics. We're a pediatric center as well. And I've got pediatrics we're treating at 1.1 ATA, 1.2, 1.3.
Yeah.
The vast majority of my patients are treating above 1.5 to 1.75, and I have patients treated at 2.8 and 3.0. We treat across the spectrum. And why do we do that? Is there's a dose-dependent relationship with oxygen. Certain tissues are going to need higher pressures. Certain tissues, like neuro tissue, respond better to lower pressure. Where those cutoffs are, that's all new to us, and it's hard to know. And the reality is that I mentioned Jason Saunders earlier, but I'm going to mention him again because his newest research is coming out on this topic specifically. And I saw him posting a little bit about this. I haven't had a chance to read. I don't think it's 100% out there yet, but what I have seen is very exciting. In 2023, we saw with hyperbaric air at 1.3 ATA, there was a 50% increase in circulating stem cells. That's fantastic to see.
Yeah.
Well, at 2.0 ATA, with a series of treatments, I think it was 20 treatments, we saw an 800% increase. There's probably somewhere in between there that's the safest and best place to be. At 2.0, it's not inherently dangerous. I have patients treat at that level all the time. It's a level I treat at quite regularly, but it's hard to know. But as we talk about these different chambers, probably the biggest thing to talk about is making sure somebody's in a safe chamber. Safe means tested and approved. So we can talk about FDA, and I'm not looking at them as the end all be all, but what I'm looking at is it means that somebody tested the chamber. The ASME and PVHO, this is the same group that said, hey, don't make your own submarine and go look at the Titanic.
Yeah.
They were right. Don't do those things. Well, if chambers are coming into America that are not tested, these are the ones that give us the most anxiety, because incidents happen. And these incidents happen actually quite regularly. They don't make it as to the forefront of approved chambers because those have to be reported, where chambers that are not approved kind of fly under that radar a little bit. So the first thing I tell everybody is if you're going to a center, the first thing you want to do is make sure they're using approved medical devices. If they have a physician, very unlikely they're using unapproved devices, because neither one of us are going to risk it with unapproved medical devices in our facilities. It just doesn't make sense. So it's just something that I look into there. So long answer for there's a lot of different chambers, and they're probably all somewhat effective, and it's hard to know what is most effective. I would look at the research and say, hey, the research for what I'm looking to treat was at this pressure. I should probably treat as close to that as possible.
Yeah. What are some of the most significant misconceptions about HBOT that you frequently encounter?
Oh, it's oxygen toxicity.
Oh,
I
yeah.
have to say that every provider that I'm talking to or talking to about their patient, I might call a pulmonologist and say, I've got a patient that is coming to our facility. I'm concerned about their COPD. Before we're talking about getting them to a chamber, I need to understand a little bit more. And they say, whoa, 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 I'm concerned about oxygen toxicity. I'm like, really? You are? Central nervous system oxygen toxicity has an incident rate of 0.068%.
Wow.
Our facilities here in Arizona have been open for 19 years. I've been the owner for about 6 years now, and I've never once seen it. It doesn't mean we don't practice for it and prepare for it and have emergency procedures. So incident rate is so rare. Now, the pulmonologists say, no, I was worried about pulmonary oxygen toxicity. I say, great. Great. I'm concerned about it as well. So we measure our patients' oxygen tolerance units, your OTUs. It's a dose dependent here as well. It's the partial pressure of oxygen times the time in minutes. And we have a cutoff in our facility, and our cutoff in our facility is well below the range that would cause any concerns. However, pulmonary oxygen toxicity is a little bit of fluid buildup in the lungs, a little bit of irritation. And it's the reason that we don't treat, back to back. We have to have at least 4 hours between treatments. Otherwise, we're going to create too much airway inflammation. And the good news is that fluid reabsorbs. And if we catch it early on, 100% reversible. So we check our patients. We listen to our patients' lungs every single day. Make sure there's no concern there. If there is a concern, we take 1 day off treatment. If there's an issue after 24 hours, we're referring to a pulmonologist. This is why we go to providers, to doctors to do hyperbaric. It's why we don't do this at the gym. They don't know what's going on with it. So that's the biggest misconception. But the other part is the on-label indications, the approved indications. Yes, in the US, we have 15 approved indications. In the international community, we're looking at about 130 approved indications. We have about 130 indications that have good research behind them showing benefit. And so our board, the International Board of Undersea Medicine, will teach, of course, the approved indications and about 30 off-label indications that we believe that there's enough research to meet the level that we use here in the United States, and constantly looking to see what, new research is out there. But, I think that we're going to see a huge number of approved indications in a short period of time here.
Yeah. Yeah. So I understand that you have personal experience using HBOT for healing after a major injury. Can you share that experience, how that experience shaped your passion for hyperbaric medicine?
It shaped my passion, it shaped my career, it shaped my life. So very early in my career, so I was on a surgery track the entire way. Before medical school, I was a surgical tech. To me, medicine was surgery, nothing else. I was never going to be a pill pusher. And I come from, a family, my father's a surgeon. And so, I had scrubbed 500 surgeries even before applying to medical school. So this is my passion. Well, very early in my career, I was involved in a crush injury. My arm was crushed so much so that the bone couldn't be put back together. After about my second surgery, there was serious conversations about amputation. And I said, absolutely not. I trust you guys, but there's no urgency in taking my arm off. You can only take it once. I'm not willing to take that step yet. I'll let it hang there. And I said, we have to do something. I said, well, you really don't. It's not infected. Let's wait and see. And that's when a plastic surgeon said, well, have you guys started doing hyperbaric for him yet? And I was like, what's that? No idea. I had never even heard of it, actually. And so I ended up doing 60 treatments in 40 days. I pretty much lived in that chamber. The swelling went down so much in the first few treatments that they were able to visualize and see everything. Blood flow's coming back. And they said, well, why don't we try a bone graft? Well, the first one failed, the second one failed. But after 60 treatments, my third bone graft took. And they saved my arm. And yes, I mean, there's a significant difference in my arms. I've got scars and, you might be able to see here. And, my pronation's terrible. It doesn't move much. However, I can lift, I can go do things. I can live a full life and I still have my arm.
Yeah.
And I had said, doc, whatever you think is best, let's just go with what I have be a much different situation. So
Yeah.
it shaped my career, it shaped my belief, and that's what got me over to naturopathic side of medicine as well. And I'm not a naturopath. I did attend Southwest College of Naturopathic Medicine, non-degree seeking. I got sick and tired of being told that this is the only approach in medicine, and my patients are getting results with things I've never heard of. And I said, I can't live in this box. I have to be open to these other
Yeah.
things. And there's some things in naturopathic medicine that it didn't resonate with me, and maybe I have a hard time with. With my current understanding, I am still trying to be open to everything new. And some things I say that sounds a little dangerous. I can't recommend it. But at the other end of it, I say that if there's a benefit for my patient and the risk seems low, I'm going to be open to it. So this changed my thoughts a lot, and it changed my thoughts on surgeons and everybody else. And a surgeon, if your only tool is a hammer, everything looks like a nail. And just because
Yeah.
you can cut, and just because you know that you can replace that joint or otherwise, it doesn't mean it needs to be done.
Yeah.
And so I like people to step back and say, where's the urgency? Let's take some time and see what else can be done.
Yeah.
It's amazing how many surgeons I talk to that don't talk to their patients about functional medicine, about diet and nutrition and peptides and otherwise. It's
Yeah.
what do
Yeah.
you mean I talk to them about that? And they're like, insurance doesn't cover it. My patients wouldn't do it. I'm like, and your patients won't heal as well.
Right.
This is
Right.
what you would do for yourself.
Yeah.
So
Yeah.
that's a lot of what changed my beliefs and my role and what I do.
Right. That's awesome. So there's a growing interest in HBOT for neurological conditions such as traumatic brain injury, stroke, cognitive decline. What are the key mechanisms by which HBOT supports brain healing?
Uh, Neurologic conditions are probably among my favorite conditions that we treat. The mechanisms start with just increasing oxygen flow to the brain. And we see this a huge increase that, the brain is especially vulnerable to oxygen deprivation, and hyperbaric increases the cerebral blood flow. But more than that, it reduces cerebral edema up to 50%.
Mm.
And in one treatment, it's
Wow.
so fantastic that we've seen this, and that's research based. Obviously, it's on rats causing an injury, but that huge change led us to look at anything that's an inflammatory neurologic condition. And when I first got started in this industry, working with people who are treating autism, I was like, guys, I don't know about that. I don't know about treating autism with hyperbaric. It turns out I didn't understand autism. I didn't think of it as a neuroinflammatory disease. And once I understood that side, I said, of course, it's inflammation. We treat inflammation.
Yeah.
And the results for these children with autism is fantastic. The number of first words spoken in
Mm.
our facility is it's amazing. So
Yeah.
that swelling in the brain, that inflammation, so is one of the first things that we see a change in. Now, neuroplasticity, creating a different route to the same information, is another aspect of hyperbaric that's just fantastic. And this takes
Mm.
us back to Dr. Afradi's studies out of Israel. And he's one of the first people that proved that we could see late stage neuroplasticity. These are my patients that have had strokes, months or even years earlier. And I stray from anecdotal evidence, but I have a patient that she had a stroke that was 14 years earlier. And when she came in, everybody said, I don't really have research to show if you'll get a benefit. I think that there's going to be benefits for you overall. I can't say what we'll see for you on your stroke. And so she did a series of treatments with us. And one day, she's coming out of the bathroom and she stops. She goes, oh my gosh, my walker. And we're like, okay, we'll grab it for you. We'll grab it for you. It's left next to the chamber. She goes, no, this is the first time I've walked without my walker in 14 years. She got out of the chamber without even thinking of it, walked all over, used the restroom, got out and walked back. And we're just like, wow, steps to take. And she's made fantastic, steps since then.
Yeah.
However, I always try to give realistic expectations. The
Right.
expectation for my post-stroke patients isn't to get back to normal. It's to save whatever we can. The stroke causes a physical hole in the brain. Our brain doesn't heal with a scar. It heals with liquefactive necrosis, which means there's a hole. Now, outside of that hole is an area where the brain's not doing its job. It's called penumbra. The penumbra is an area of low metabolism. We wake that up very early. The very first results we see are there. And so our patients come in and first few treatments, they start to see something, they love it. And then maybe they don't see anything for a little while. It takes longer, more treatments to see those results. But I always want to let them know that we're trying to create a new path to that same information. We're not going to get everything back more than likely. We see speech come back for a vast majority, speech and swallow. And why is that so important? Well, speech is, socially isolating without it, but
Yeah.
swallow is, this is our biggest risk of them passing away. I mean, if they are aspirating, this is the biggest risk. And this isn't just our stroke patients, hypoxic brain injury, cerebral palsy. And there's so many situations where swallow is so important. So that's a huge aspect. So we're talking about, traumatic brain injuries, but we might even want to talk about PTSD or Parkinson's, autism, hypoxic brain injuries. There's a book that never leaves my desk, and it's Hyperbaric Oxygen Therapy for Neurologic Disorders. I got to tell you this, and this is from UHMS. It's great research in there, and I'm constantly referring back to it because the studies they refer to are fantastic. Everything we do here is based on published data. I don't throw things at the wall to see if they'll stick. And if somebody comes in, they're like, I have this disease process that you've never heard of. Is hyperbaric going to work? I have to tell them, if there's not research on it, I can't tell you. But hey, let's look at the disease process. Let's look at the pathophys. Let's look at the drugs you take for that disease. That drug targets this pathway. Hyperbaric does that same pathway.
Yeah.
It stands to reason hyperbaric may play a role. And I've got a patient in mind on that one right now. And maybe if there's time permitting, we can get into it, but I can get long-winded. So
okay. So in cases of head trauma, such as concussions or TBIs, how soon should somebody start HBOT to maximize its health benefits?
Oh, referencing that exact same book, you're right there on the treatment of acute traumatic brain injury. The importance of treating early, I think it's paramount. It reduces or minimizes secondary injury by ensuring adequate oxygenation. There's a lot of research going into this. I have to say right now, there's no consensus on when we should, how early that intervention is. But I would say that most research on this is early intervention gives us better results.
Yeah.
In our facilities, as soon as you can get to our facility, we will treat you. As soon as you're released from the hospital, as soon as you're ambulatory enough, although in our facilities, we have multi-place chambers. I can wheel you in, I can put you on a stretcher. We have ventilator ability. We have every aspect because I want to be able to treat everybody we can. You want to have somebody in a chamber as soon as you can and treat safely in the facility that you're treating in. So I think that makes a lot of sense. For concussions, we get these athletes in or students or otherwise, the day of, the day after, if you can. Now, the field of neurology can be a holdout on doing that. And I usually ask, what's the pushback? What's your recommendation? What would you do? They said, well, we wait and see. I'm like, I don't heal by waiting. This is not what I recommend for anybody. I want somebody to treat right away to see what we can preserve, especially if the risk is minimal. And it really is.
Yeah, it makes sense to treat sooner rather than later.
Yes.
So have you seen HBOT make a difference in neurodegenerative diseases like Alzheimer's or Parkinson's? And if so, what improvements have you observed?
There's another place where I try to steer clear of anecdotal evidence, but it's hard not to with the results that we see. We see fantastic results for our patients with cognitive decline. In Arizona, we definitely have an aging population. We're retirement, centers here, and we treat so many people for Alzheimer's, but also just for prevention of cognitive decline. So for our patients with true Alzheimer's dementia, we have seen across the board changes, which typically, again, with speech, but also with mood, some of that depressive, change. It's honestly one of the best things I get to see with my patients is treating patients that are in that level of cognitive decline. In our facilities, we won't treat severe cognitive decline, but we do treat mild to moderate decline regularly. If we're talking about vascular dementia, it's one of the ones we see the biggest change in. Think about it. vascular dementia, not enough blood flow, therefore not enough oxygen. What
Mm,
happens when I put somebody in a chamber and increase that oxygen significantly day one? Their results are relatively quick. They really are. And we're growing brand new blood vessels.
yeah.
Now, Parkinson's is a little bit different. The number one change we see with our Parkinson's patients, especially based off published data, is the change in the depressive symptoms.
Uh,
And so Parkinson's has a certain mask, a face that somebody comes in with, and clinicians get used to seeing this, and we see a change in that, which is fantastic. Uh,
yeah.
one of the biggest causes of death in Parkinson's is suicide.
Yeah.
So if we can change depression in these patients, it's amazing. Now, these patients, for cognitive decline, they usually see a change probably within that first 20 treatments. If it's Alzheimer's, we're usually doing 40 treatments, probably with a break, maybe another 40 treatments. This is not a slow change. You spent 70 years getting to this point. Don't expect we're going to change it in 40 days.
Right.
And then on the preventative side, that's hard too. So we can get into that because I think that's probably what you're about to ask into, isn't that?
Yeah, yeah. So is HBOT something that that can be used for preventative brain health, or is it just for acute and chronic conditions?
And so I think it's for preventative. I think it's absolutely something we use for preventative. It's hard because how do you quantify prevention? Well, you didn't get the disease, you didn't get that, but people fall off on prevention all the time. It's hard because we're treating inflammation, and so this is where we should get to the point of maybe we talk about the prevention is stopping inflammaging. This is a new term that we're using regularly. The inflammation this chronic inflammation leads to the accelerating of the aging process. And that aging process can be aging of the brain, aging of the blood vessels, aging of so many different tissues. So we protect the brain there. This is protecting other tissues as well. If we're growing brand new blood vessels, and if the majority of our tissues, are really dependent on a good blood flow, like think of our kidneys, a bag of blood vessels. If we can grow brand new blood vessels there, we should be able to protect their function.
Yeah.
If we're talking about, as simple as, just fingertips and toes, eyes, all these areas where we can grow more blood vessels, we're going to prevent something there. So, it's hard on the preventative side because those patients don't quantify what their results are. They don't really know. They say that oftentimes they just tell us, I can't describe what I'm noticing. I just feel good. And so then we keep those patients on a monthly program at that point. And we have a huge number of patients doing that with us now. And it might just be 6 treatments a month. And I push them to do those 6 treatments back to back.
Back to back. Yes.
Hyperbaric is always consecutive treatments. So
Right.
the initial 20 treatments is 20 days in a row. The initial 40 is 40 days in a row. If we're doing some sort of maintenance and we're doing, hey, I want you to do 3 treatments, it's 3 treatments in a row.
Yeah.
Or whatever level, but I never am telling somebody come in 1 day a week. It would save your time, your energy, your resources.
Right. Right. So chronic inflammatory conditions like mold illness, Lyme disease, and autoimmune disorders are notoriously difficult to treat. How does HBOT help in these cases?
Uh, it is a loaded question there because they are notoriously hard to treat. And, hyperbaric can play a role in each one of these. And let's kind of break them up. Let's focus on autoimmune. So autoimmune is your body's attacking itself. Inflammations run amok. That's usually due to a certain cytokine called IL-10. Hyperbaric has this amazing ability to increase IL-10, which is your natural off switch for inflammation. So if I look at something like rheumatoid arthritis, and I teach the autoimmune track at the International Hyperbaric Association. So I've got a lot of research on this. So, rheumatoid arthritis, if I give you drugs for this, the DMARDs or the biologics, they usually focus on TNF alpha, but really IL-10. And by increasing that, the drugs are very effective. So why don't we try using hyperbaric instead? And I got to tell you, we do better than the drugs based off some of the published studies. I have a study that shows that 6 and 9 months after completing hyperbaric, that our patients with rheumatoid arthritis had no progression of the disease, no synovitis, no joint destruction at 6 and 9 months, which is better than if you went off a biologic and
Yeah.
waited 6 or 9 months.
Right.
Not to mention these drugs are, you want to talk about costly, you want to talk about, the effects they have, or even just, and this disproportionately affects women really, is that these drugs have a huge effect on the endocrine system and reproductive systems. And now a woman has to make the choice between living in pain or family planning. And it's just not fair in that regard. Hyperbaric shouldn't be used during pregnancy. However, we have 6 to 9 months after we finish that last treatment that there's a protective effect, giving good ability for that family planning should somebody choose to do that.
Wow. Can you explain how HBOT supports mitochondrial function and detoxification, especially for patients dealing with mycotoxin exposure?
Yeah, it's hard to get away from mold. It's hard to get mold out of the body.
Yeah.
Mold likes fat, and I'm not talking about the fat we can pinch.
Uh-huh.
This is the fat that surrounds every cell. It's called your phospholipid bilayer, and so molds can get right into there very easily. And oftentimes, if you're using drugs to help, attack the mold, we're attacking our own cells. And that mold might just come out of that cell and go right into another cell. So hyperbaric plays the role here by upregulating the mitochondria, giving it more ability. And by doing that, it decreases cellular senescence, that cells that are sleeping, gets it back into its cell cycle, which means cell turnover, get to the end of its cycle, program cell death, get out of the way so a younger cell can come in, take over, and do its job. And now, as that cell turns over, it allows that mold to be excreted along with the cell. However, these patients need to be on binders. It's one part of the process is hyperbaric. So, that mitochondrial function is fantastic, but hyperbaric's one part of that puzzle. Those patients are probably going to be on binders to help, maybe even on antifungal drugs. It's hard to treat mold, and mold is in allopathic medicine, I think, very oftentimes overlooked. And it's probably because no two people really respond the same.
Yeah.
I can be in the same environment as my patient, and they are just extremely toxic with the mold. And my genetic makeup allows me to tolerate that. And I might not have the same symptoms. People living in the same household. So now it becomes, what's wrong with you? We're living in the same place. There's nothing wrong with me. We're just not responding the same. So it's hard, but hyperbaric has been fantastic in that regard. But you're going to find that our patients with mold, and probably Lyme to another degree, because these can go hand in hand, some of the harder patients to treat.
Yeah. And which brings me to the next question, which is, Lyme disease is known for its persistence due to biofilm formation and immune system evasion. So how does HBOT address these challenges?
Lyme, we have to make a distinction. There's active Lyme and there's chronic Lyme. This is done by looking at certain markers. Active Lyme, you still have the spirochete in your body. It's still going through process. It's still replicating or otherwise. High pressure, hyperbaric, 100% oxygen will destroy that spirochete, and it's fantastic, the results. However, your patient's going to hate you. You're going to have such a significant response. They're going to have, and I always murder this name, the Herx-Jerkheimer reaction.
The Herx reaction.
Herx. I've never gotten that word right. But they're going to be very unhappy with you initially. You're breaking it. The proteins from it are out in their body. Their body's responding. That's what you want. In chronic Lyme, it's a different approach. But in both situations, our body is not good at fighting Lyme due to these biofilms. It leads to this immune system evasion that you're talking about. And so hyperbaric has done a great job of actually destroying biofilms. It's not in every biofilm that we can talk about. Different biofilms have different responses, but we have so many studies showing efficacy in killing bacteria with biofilm production, allowing for better penetration of antibiotics, better outcomes for patients. So it really, first we kill the biofilm, and then we're also upregulating your immune system, supercharging it. So now your body's immune function is there to take over and have a synergistic effect with the antibiotics you may need. So Uh, there's a huge effect for these patients, but again, Lyme is hard to treat. It just
Yeah.
is.
Yeah. So for patients with severe inflammation or chronic illness, how many HBOT sessions are typically needed before they start to notice improvements?
This is the hardest question of the day. It
Yeah.
is. The reason this is such a hard question is because no two patients respond the same. Our
Yeah.
makeups are so differently, and how we handle oxygen is different. And it might be from, somebody that grew up at high altitude. It might be somebody that has a lot of physical activity, carries a lot of muscle mass, or somebody that was sedentary. So why do my athletes and people that carry a lot of muscle mass, or people that used to be athletes, respond differently? It's mitochondrial density. And you might have seen this in somebody. If you have somebody that, used to, work out all the time, somebody that was in the fitness industry, and then they go start to work out again, and they just kind of snap right back. The muscle memory is a real thing. That's
Yeah.
mitochondrial density. It's like
Yeah.
having more engines in your car.
Yeah.
So if I give you the same fuel as I give a professional athlete, they're more efficient with it. They get better results. Why do I see professional athletes getting such amazing results with mild hyperbarics and bag chambers? Probably due to their mitochondrial density. So many athletes using them, getting results I'm somewhat surprised about.
Yeah.
So they're going to need less treatments to get the same results. My sedentary patient, diabetic, metabolic syndrome, they might not recognize any change for a long time. They might
Yeah.
not feel that change. So I typically set my first follow-up appointment at 5 treatments. I expect some change at 5 treatments, not the change they're looking for. I expect a
Yeah.
change in sleep with everybody. And somebody at this point in the consultation always says, sleep's not my biggest issue. And I say, honestly, it's not mine either. When I treat regularly, my sleep's better. It's better. The
Yeah.
aura ring tells me it's better. I notice it's better. As one of the main reasons I actually continue to treat as much as I do is how much better I feel overall. And I know it's
Yes.
a issue. Then the next point is I see a change in pain. It's easy to change pain with as a COX-2 inhibitor, the same thing as ibuprofen. And typically we see this oftentimes in major joint capsules, shoulders, hips, knees, easy places to get into. And the research shows us that as well, because look at scuba diving. Look at what happened to my patient that was underwater too long. They got the bends where hyperbaric all came from. Shoulders, hips, knees, major joints is where it first bothered them. It tells us that it's easier to dissolve a gas into these areas, or maybe it mobilizes better to these areas. But
Hmm.
that's where we see a change. So, other changes, they might take 10, 20, 30, 40 treatments. And some patients, maybe even my patients with autism, I might not see some of those changes until we stop treatment for a little bit of time. My
Yeah.
children with autism, oftentimes 30 and 40 treatments is where we start to see some of the first real change. Sometimes other ones we see it early, but it's why we have our patients try to keep notes, keep a journal. We give every
Yeah.
patient now a hyperbaric journal they take in every time, write
Oh,
down something every time. And
yeah.
that way when we sit down, I don't just have our chart notes and my text notes or otherwise to go off of. I have their words. And that way I also can ask them to share their hyperbaric story sometimes as well. It's
That's a
something we're
great
now
idea.
having every patient do is post something in the front of the books. We have a large library here. It's not, now you can see behind me, that's my library. Outside this door is about 5 times this size of
Yeah.
books. And they share their story right in there so they can read about what somebody else saw and how many treatments it took them to see that change.
Oh, that's great. That's a great idea.
Yeah, it's a fun idea.
Um, so what are the safety considerations for HBOT, and are there any contraindications for certain patient populations?
Yeah. Hyperbaric is actually one of the safest treatments in medicine. It really is. However, there's safety concerns with everything we do. And so if we clear our patients, do a proper history and physical, we're not going to see major events. The biggest concern for every patient is middle ear barotrauma. And that simply means pressure affecting the eardrum. It doesn't mean we burst their eardrum or cause
Yeah.
a perforation. In fact, that's exceedingly rare. But somebody come out and be like, our ear's a little full, or it sounds like I'm talking with my hand over my ear,
Yeah.
extremely common. So that's by far the most common. I want to say 2 to 3% of patients based off of published data. Outside of that, the other incident rates are so minimal. I mean, a little bit of vision change, it's always transient. If we already have cataracts, we could possibly make them worse. But so most recently, we talked about this, seeing this major tragedy, a fire inside of a chamber, something that should never happen.
Yeah.
So it's the reason we use the chambers that we use. We are
Right.
never going to have this issue in our chambers because they're not considered oxygen enriched environments. We keep it below a certain percentage to make sure that a spark is not going to cause a fire.
Right. Right.
And the turnover of air in there is so fast that we're not worried about oxygen building up or CO2 building up.
Right.
So
Yeah.
this now manufacturers are all switching over to this. The big name manufacturers of the past have now copied this design, and most of these chambers coming out don't have those issues anymore. What happened there in Michigan, we're not 100% sure, but more than likely simply due to static electricity,
Yeah.
maybe a possibility of a chamber that was had some issues with it over time. I can't say, I don't think anybody else can at this point. But so it comes from first clearing your patient selection. I wouldn't put a patient in a 100% oxygen chamber. They couldn't sit perfectly still.
Yeah.
They couldn't make sure the grounding strap or grounding pad wasn't perfectly on them. The contraindications that we talk about, there actually are a number of contraindications. However, the vast majority of them are relative contraindications. I'm not going to get into the entire list because I don't want to scare anybody away, because the reality is that for every contraindication, there's a time and place. And so we might say, I'm never going to treat a patient with a pneumothorax, a hole in their lung. And you're right, in both of our facilities, we're not going to. In the hospital, we are. For life and limb saving treatment, of course we are. So for every contraindication. Now, some of the big ones, if you're on a chemotherapeutic, we're going to make it more toxic. And so we're going to say that's a contraindication. However, I work with a couple of natural cancer centers here in town that use low-dose chemotherapeutics. And they're using about 1/5 of the dosage of some of the chemotherapeutics that we would say are contraindicated, and getting the same results by putting them in hyperbaric. So we're upregulating it, making it more toxic by using hyperbaric and using a lower dose and getting the same effect. It's fantastic. So it's not a contraindication now. So I would say the way you're going to make sure you get safe treatment as a patient is you're going to go to a center that has a physician that makes sure they give you a clearance and prescription. If the center you're looking at doesn't give a prescription, they're not really following the regulations. Hyperbaric is actually technically requires 2 prescriptions. It requires a prescription for the oxygen, a prescription for the chamber. We combine them in one, but it's this is a medical treatment that requires proper clearance. If they're not requiring prescription, you're probably not in a safe center. They're skirting the basic regulations. And I don't know what to tell you. Only choose clinics that are ensuring your safety above all else.
Yeah. How does HBOT fit into the broader functional medicine approach? And are there complementary therapies that enhance its effectiveness?
Oh, I can't think of a therapy that fits better into the functional or even naturopathic world better than hyperbaric. I mean, we're using oxygen plus pressure. It provides a foundation for healing. It's like building a good foundation is how you build a good house. All of our wellness, that we do for ourselves comes from building a good foundation. I brush my teeth every day to make sure I have a good foundation in my health. I have my daily exercise. I eat well. The fasting that I do. And so we talk about how do we complement hyperbaric. The research here is probably a little bit lighter, but we can look at what makes sense and what's going to help mitochondrial health. And if it's going to help mitochondrial health, hyperbaric should also have an added benefit to that. So there's a lot out there that we use for mitochondrial health. Maybe we're talking about, red light therapy, methylene blue, PEMF. I don't have research showing benefit on these things, but it stands to reason. Now, I do all 3 of those things. I've been taking methylene blue for almost 2 years. If you told me I had to stop all other supplements, I could only keep one, it would be the methylene blue. In fact, if you told me methylene blue versus hyperbaric, I might have a hard time making a decision at this point. I really would. It's had the most profound effect on my, I think, my cognitive faculties. I leave a conversation, I sit down, and I feel like I could write it down like a book these days. So that will never change. Now, my toilet is also dyed so blue at this point, it'll never go back. So there's that part too. So, I do these things regularly without knowing if there's that enhancement, but we do know Hyperbaric does potentiate some things like antibiotics. We know that for sure.
Have you seen HBOT combined with therapies like ozone, IV nutrition, peptide or peptide therapy for
Oh,
synergistic effect?
absolutely. Yeah. We have referring providers that are doing these things regularly. That synergistic effect is real, even though I don't have a way to quantify it yet. IV therapy is probably the greatest example. So we talked about at the very beginning, your bodies may have mostly water, but we're all walking around relatively dehydrated. It's the reality of the situation.
Yeah.
If I give you an extra liter of fluid before getting in the chamber, I have a whole extra liter available of fluid that I can push oxygen into. There's a point where at some point I can only fit so much gas into a liquid, but by expanding that volume of liquid, I can fit more oxygen in. The next step to that is the solutes that are inside of that IV, I can drive them deeper into tissue by adding pressure. It's called driving force. So because I teach for the International Board of Undersea Medicine, I teach these concepts regularly. And there's something I asked the head of our board, Joe Dituri, say, hey, I really want to do this process as part of the training. I want to make hyperbaric pickles. And he's like, okay, what do you want to do? So I want to make pickles in the hyperbaric chamber. I'm going to show you how. He said, great, I love it. I like the idea. This is a CME event. Absolutely not. You can do it during lunch. So that's what we do. During lunch, we make pickles in the hyperbaric chambers. So what we do is if you take an actual cucumber, take your solutes, and this is, just like an IV. I've got sodium, I've got water. Yes, I've got sugar, I've got other things that are going in there. By adding pressure, I force that liquid, but by extension, all those solutes into that tissue with a gas.
Yeah.
And it only takes us 15 minutes. If you're ever out here in Arizona, you come do it, we'll make a hyperbaric pickle. We'll do it for the podcast or otherwise. In 15 minutes, we make, honestly, really good pickles that you would not even know was possible. I'll share the presentation because it's fun.
Okay. Yeah, that's fun. That sounds really amazing. What advice do you have for someone considering HBOT, but feeling hesitant due to cost, time commitment, or skepticism from conventional practitioners?
I love the skeptical patient. The skeptical patient's going to do the research. They're going to read. They're going to take what I give them and say, oh, great, I want to look at the data and understand, because they're going to make more informed decisions. So I try to take cost out of the equation. I understand that for everybody out there, they can't. This is their life. It's their ability. But as a good provider, I'm going to give the same, recommendations to a billionaire to my patient who's on Medicaid, because that's what good medicine is. I'm going to focus on the research. And I wish I could say, I'm going to give all this away for free and do this in that regard. But hyperbaric has a real cost to it. I think you'll probably see that the cost is actually less than most people think. If you Google hyperbaric oxygen therapy, what it costs, you're going to get a lot of the hospital-based costs, up to $1,114 per 15 minutes. So if you go to some of these, hospitals, they're going to charge you $14,000 a session if they'll take cash. Whereas most centers outside are charging, maybe somewhere in the $200 range. It's hard to know where you're at based off it. Here in Arizona, it can be anywhere from $200 to $350 a treatment. But if we look at that cost versus what the effect is, if we can do something for our patients with autoimmune disease, this is less of a cost than half the medications they're taking. If you're talking about the DMARDs and biologics, those can be tens of thousands of dollars a month. I mean, it's outrageous. And we can have a similar effect with a short series of treatments. So what I try to do for our patients here is get them to do a short series, get them to do 10 treatments. If I can get them to do 10 treatments, I got them hooked. And it's kind of a joke there, but seriously, if we see that change together, then they're going to continue. And so for a lot of our patients, not autoimmune, but for a lot of our patients, we're not talking about maintenance. For a lot of patients, once we've upregulated these processes, you've got to the point where it's already taken care of, like sudden sensory neural hearing loss. You wake up one day and you can't hear anything, and you come in with hyperbaric, and we can get 19 to 34 decibel gain with hyperbaric. I mean, it is fantastic, and they don't ever have to come back.
Right.
It's amazing what we see with that. Now, I understand coming to our facility, doing a daily dive is time consuming. But would you have these same questions for somebody that says that I need to go do brachytherapy. I have to go do radiation every day. I have to go do, dialysis every 2 to 3 days. No, you
Yeah.
do it because that's the standard. Hyperbaric, you give me a relatively short period of time. Give me
Mhm.
a month, and you might never see me again and have just a fantastic change or quality of life based off that. I give patients all the information and hope that they read it and make informed decisions.
Yeah. Well, so where do you see the future of hyperbaric medicine heading, and what innovations are on the horizon that excite you the most?
So I'm very involved in Hyperbaric's future because I'm a member of a lot of these boards, and so as a member of UHMS, not on the board, but as a member and teaching for the International Board on Undersea Medicine and even medical advisor now to the National Hyperbaric Safety Association, I have a little insight to what these changes are coming. I mentioned these irritable bowel syndromes, irritable bowel disease. I think these are things that are going to be on label indications very soon. However, I believe the majority of the change is going to be coming from the people. I think as more people start to see and talk about the changes they've seen, that they're going to be coming to the forefront and letting people know that, if you're sick of the system of sick care, you're tired of this standard of more prescriptions and less treatment and just letting people take health into more of their own hands. I foresee the future of being incorporating hyperbaric into people's regular wellness routines. Just like I said, just like brushing your teeth every day, exercising, eating a healthy diet. Hyperbaric, I could see, coming commonplace in somebody's daily routine.
Yeah.
And I really hope for that day, because the more it's out there, the more cost effective it will be, the more research we'll have, and the more accessible it will be. When people look for centers, it is very hard to find centers. You're in Houston area, Sugarland,
Houston.
right?
Yes. Yes.
Yeah. And in Houston, I mean, it's a major metropolitan area. And if you're talking about real hyperbaric providers in Houston, there's very few.
Very few.
I mean, it's shocking. In Scottsdale, Phoenix area, we actually have a few more, but major metropolitan areas, it's few. You talk about going to rural areas, there's none.
None.
There's none. So our big push here over the next few years is to try to push more centers opening up. One of the websites that I push regularly now is hbotdoctor.org. It's a free listing service for all the hyperbaric centers out there. It doesn't charge anybody, and it's a way people can find centers around them that have FDA approved and safe equipment, and people can put up their information, and then it can be reviewed or otherwise. I think it pulls in reviews for other places, but I'm a big believer in letting people speak with their experiences.
Great. That's awesome. Well, thank you so much for your time and all this expert information and advice. It's been fantastic. Really enjoyed it.
Great. Well, thank you for giving me the opportunity to talk about hyperbarics. If you ever give me that opportunity, I'll be here to talk about it. So
Awesome.
everybody who tuned in, I really appreciate you taking the time. I know we spent a lot of time and we've scratched the surface. So if we get a chance to talk about this again, I'm sure Dr. Ward will come up with a subset of topics, and we'll dive so deep into it.
That would be great. That would be great.
Thank you so much.
Thank you for joining me on The Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the functional edge.